Last week, I turned my focus towards exemplars that I can learn from. I was very lucky to tour the UT Southwestern Medical Center Simulation Center. It's one of the largest state-of-the-art simulation facilities in the nation, so that healthcare learners can develop into becoming effective, compassionate, and competent clinicians. To create realistic scenarios, they have a variety of high-fidelity dummies, and so students and sometimes faculty can practice intubation, teamwork in emergency situations, and robotic surgery. On the left, Crystal Campbell demonstrated learning how to do an ultrasound with the dummy, showing the ultrasound as well as a diagrammatic representation of where the wand is in relation to the organs. On the right, a realistic surgical suite was set up for simulations of anesthetic complications during surgery. They were even playing soft jazz music in the OR to calm the team, I suppose. The simulation spaces have control rooms with one-way mirrors where the simulations are observed and monitored and recorded for later debriefing. I was impressed with the training process they go through for robotic surgery. They use what in my world would be called the flipped classroom, where students learn at home and master skills on their own before they move up to the instructional activities that require faculty supervision.
So this is one of the FLS fundamental laparoscopic surgery boxes here. So what the whole goal would be to, as you can see here on the monitor here, is a piece of gauze. So what the resident would do would have to cut both inner circle and outer circle around the marking here of the circle.
And it requires a lot of upkeep and innovative problem solving to support diverse learning goals. For instance, the in-house engineers are 3D printing a hand that you can inject fluid into. To practice suturing intestines, they use realistic biotissue that feels like and tears like real tissue. The hospital simulations are exciting and very impressive, but you won't be too surprised that I was very interested in the outpatient clinic simulations, where students read the patient history in the hallway and then practice exams with standardized patients.
For standardized patients, we have about 120 that appear in as needed. And so for them, when they are assigned a sim, they'll come and get specialized training, depending on the case. They will perform them very standardized, so every learner gets the same opportunity and same experience during the sim. And they're also trained on providing feedback on the learner's performance, but it's not technical or medical, but very patient perspective-based.
What does any of this have to do with informatics or learning health systems? Well, at the University of Melbourne, we built a simulation lab for human factors research on digital interventions like clinical decision support, AI, and virtual care. The goal of the Validitron Sim Lab is to test the human factors aspect of digital interventions, to help design user interfaces and workflows in more realistic environments like the GP office, the hospital, and even the patient home, where patients are increasingly interacting with the healthcare system through telehealth, remote monitoring, and virtual care. The digital sandbox allows you to replicate your local IT infrastructure and embed your designs or real applications into the existing system to ensure interoperability and feasible workflows. Kit Huckvale is the director of the Validitron and the interim director of the Center for Digital Transformation of Health that I built. He points out that a key determinant of implementation success is incorporating not just questions of the tool's quality, but also what happens when it's put into its intended socio-physical and digital context of use. As part of my recruitment here, Eric Peterson and I wrote a GURI grant proposal that was awarded to UT Southwestern from the state of Texas. The goal of the GURI is to develop a UT Southwestern version of what we built in Melbourne, focused on discovery from EHR data and simulation for human factors research. I'm currently calling it the Learning Health System Discovery and Simulation Studio. We're in the early phases right now, thinking about the types of use cases we could perform in this type of studio. The main goal will be research, starting with discovery from our data, as well as de-risking and validating new solutions before implementing them in real patient care. The use cases will drive design of the digital environment. You can envision a lot of education opportunities as well when you combine immersive simulation environments with a realistic digital environment. We'll work closely with the directors of the Simulation Center to look for win-wins. Looking forward to continuing to bring learnings from UT Southwestern to you and also sharing learnings from outside programs that I'll be visiting, starting with the Vanderbilt Clinical Informatics Center. If you've seen previous videos of mine, you know that we ride electric longboards. We had to sell them when we moved because you can't ship large batteries, but we replaced them and are getting our dogs accustomed to running with us again.